Now's the time. I see we're still getting a couple of people sort of filter in, so I'll give it 30 more seconds and then we'll crack on. So hello to everyone who's here so far. Yeah, people keep joining, but my list doesn't change the numbers. So, okay, well, what we'll do is we'll get started. So what I'll do is if I share my screen with everyone, the first thing would be is if everyone can tell me when I've done it, if they can see it. Find the right one. So yes, can someone give me a nod if you can see?
Yeah.
Yes.
Portfolio, brilliant. Okay, well, we're not going to look at that yet. I'm just going to bring up a quick presentation. So that should be replaced by a really big blue SARD.
Mm-hmm.
Lovely. Right, well, so go through a couple of housekeeping things. As I've already mentioned, we are recording. So yeah, anyone who doesn't want to be on camera, just pop it off. For anyone that does, you're very welcome to stay on. So I'm going to run through the agenda of what we're going to cover today. But in terms of sort of how the presentation will work, we will have a question section at the end. So I tend to run through the whole thing. And if at the end, if you've got any questions, if you just scribble them down or write them down in the comment section, we'll get back to those at the end, just so we can make sure that it sort of runs through neatly and tick off anything as we go. We'll also follow up with you all afterwards, see if there's any feedback or if you've got any queries that you think about after the meeting, after the session itself. So first and foremost, I'm going to pop up the agenda if you'll let me. Yeah, so introductions. Now there's a few people from SARD in today, and we're not going to spend time going through and introducing everyone, so I will just introduce myself. I'm Phil Bottle. I'm the Director of Sales and one of the co-founders of SARD. For those of you who don't know me, I worked in the NHS before we started this venture some 10 years ago. In terms of what we're covering today, I'm a little bit disappointed because Physician Associate, I've found, is one of the hardest job titles to say. And I'm going to have to say it a lot, so you're going to have to bear with me around that. But the purpose of today is how we can utilize our systems to really tick off what the Physician Associate requirements are around personal and professional development as they move through. So to start with, though, I'd just like to take a few minutes to talk about who we are. Now, I know most of the people I think that are attending the webinar now work with us in some capacity, but there will be some people that will see this outside of this particular session. So I'm just going to quickly run through some of the about us information. Then I want to go into the Physician Associate background and requirements, because they're actually key to what we're going to show you today. Talk about how our systems work to ensure that we can cover off those requirements and help Physician Associates get through sort of the annual requirements all the way up to sort of the examination processes that take place. And then at the end, there'll be an opportunity for everyone to either provide us with feedback or ask any questions that you may have. So a little bit about us. As I say, most of the people within this session probably know a bit about where we come from, but as a refresher for those that don't, so we are part NHS owned. We started 10 years ago. Myself and Kevin were building systems for Oxley's NHS Foundation Trust. I worked there as a head of learning development, and it kind of snowballed from there. We built a number of systems internally, and then we built a revalidation system, and that kind of turned into something different. So the business started in earnest in January 2012. So we're almost 10 years old now. And since that point in time, when we started with a single client, we're now up to just over 50 trusts. We look after roughly around, it's actually 50,000 odd users now. But we always try to maintain a very single promise to everyone that we work with, which is we provide great technology and great customer service. And as much as I'm going to talk about the product that we want to show you today, I think it's really important to emphasize that this is actually the Physician Associate requirements is relatively unique in terms of how we've approached something, because it's actually our ethos that has allowed us to quickly transition to utilize the systems we've got for the purposes of this particular group. And as you can see, hopefully on the screen, we've always had a focus on innovative technology that's flexible, and that's really the key here. But besides all of that, we will always look to maintain really strong relationships and end user support for every user. So all 50,000 users have the ability to speak to us, as most of you in the room will know or will probably had interaction with our support team over the years. So what we do now, general, these are the main areas that we look at. We started with medical revalidation, then we built 360 for job planning, initially for medics. We now have it for all clinical staff, e-leave. We built an e-rostering system, nurse revalidation and appraisal for all. And actually, the nurse revalidation and appraisal for all will come into play when I talk about this as we move on, because actually we've got two systems at the moment that really will help physician associates go through this process. But essentially what this hopefully builds a picture of is that we don't stand still. We're always looking to develop systems that meet the needs of our clients and potential future clients, because things change. And actually, when I get onto the background of physician associates, I was quite surprised actually in terms of the history, because this is a relatively new thing for us. So in terms of client base, as I say, we're up to about 50 now. We cover full spectrum of very small mental health trusts to very large acute trusts, and some organisations that work in the health sector space but aren't necessarily trusts themselves. And obviously across all of the trusts that we work with, we deliver different modules. Some have more than others. We're always obviously happy to discuss what else we do. Just also wanted to touch upon this as I did actually in our last webinar, because I think it's useful in understanding the fuller picture of what we're trying to achieve, which is there is much more of a focus around workforce now with regards to how systems talk to each other and interoperability. And I really just wanted to display this because to make sure that not just within this particular solution that we're going to talk about, but all of our other solutions, that we have a really keen eye on making sure that we can utilize all of our systems as a sort of single suite of systems that can talk to each other. But equally, for those of you that utilize other systems, but may look at this particular option as something that can sit alongside what you already do. So we're really keen to make sure that it's clear that we look at sort of making sure we've got open APIs, that we can talk to other systems, and of course talk to our own systems. And again, that becomes important as we go along with the solution I'm going to talk to you about now. So in terms of the background itself, and this is the bit that kind of surprised me, other than the fact that I trip over the name Physician Associates every time I try and say it, this really came to our attention when we took Leeds Teaching Hospital on, and they asked whether or not we could whether they could utilize our revalidation system for their physician associates. And it was relatively new to us as a concept for system use. And then actually I had a chat with a physician associate from Epsom who told me that she qualified in 2012, which was interesting because I thought it was a lot newer than that. And then I found out when going through that actually physician associates were first formally introduced in 2003. So it's something that's been around for a long time. And I think actually the reason why it started to build quite quickly now is because the numbers are growing. and there are sort of requirements that are equally growing, and the faculty of physician associates are pushing more and more. So, but we'll get on to that. In terms of the individual users, obviously, they undertake generalist medical education. They're health professionals, and they work alongside, obviously, doctors, physicians, GPs, surgeons, supporting diagnosis and management of patients, and working in multidisciplinary teams. So there's obviously quite a lot of crossover with what we already do. They sit under the purview of the Faculty of Physician Associates, and they are really there to support the physician associates across the UK. So if you're a member of the FPA, then you're part of this professional membership group. And the other key function of the FPA is really about setting the standards for education and training, and undertaking the national certificate and revalidation examinations. There is also a final part of what the FPA really get involved in, which is a physician associate managed voluntary register. Now, this is important because it is a register that essentially allows employers to check whether applicants or current employees are fully qualified and approved as physician associates. Now, all of that is important because obviously it talks to the groups that PAs interact with, and as most of you here will know, we work already with those groups, have done for the last 10 years. So it's not too much of a step for us to move from what we have been doing to where we sort of need to be. But equally, and most importantly, really the second to last point around education and training. And that's where we come in terms of what the systems that we've got and how we can utilize them to capture that information. So as part of the PA role, there is, as I mentioned before, there's an examination process that takes place once every 6 years. Now, the conversations I've had, I think there's been an idea that this may change. It may not. From what I've looked into, I know that they've changed it to an online examination as of September this year, but I don't know whether they're going to change anything further. But that's actually again something that I want to talk about as we go through, because change is not our enemy in terms of how we operate and how we deliver our systems. But the really key part for us is around the personal and professional development toolkits. So the Faculty of Physician Associates consider that sort of ongoing training and high performance of all PAs is vital in terms of sort of like delivering this high quality healthcare and maintaining professional standards. And that really chimes with all of the stuff we do around medical revalidation. And where they've kind of stepped in is to say, look, these are the sorts of things that are required as part of the sort of portfolio of evidence, making sure that you have ongoing and up-to-date evidence of certain areas, things like development of skills, knowledge, education, management, leadership, and any other activities that are useful. And actually, one of the things that was suggested from that was an actual portfolio or profile structure. And that's really where we come in. So I talked about the idea of change not being our enemy, and flexibility when I sort of started this webinar. And that's exactly sort of its core to how we've been able to transition very quickly around this area, which is the power of configurability. So for those of you that have seen or use our revalidation software, you'll know that our portfolios are incredibly configurable. And as such, it means if things change, if processes change, if internal policies change around how things need to be delivered, what the requirements are for PAs, whether locally or nationally change, for us, that's not an issue. In fact, it's very straightforward for us to deal with that. So what I'd like to do now is actually come out of this and move into the systems itself. So hopefully, if Kev, if you can give us a thumbs up, you should be able to see Dr. John T. Smith portfolio. Yeah, lovely, thank you. So actually, I brought you into a system that I'm not really going to talk about much, which is the demo site for our medical revalidation system. But the reason why I've done it is because I want to show you the in an instant how configurable our system is. So this is just a demonstration site of a portfolio for a doctor, and it covers a range of different areas, some of them made up just to show that we can add anything we want. And then I can quickly move over to what we did for Leeds, which is a portfolio purely for physician associates. And in terms of where we got the information from this, we actually took, if I can quickly find this one, we took the December 2019 Personal and Professional Development Toolkit suggestions. So in here, it's very clear. This is a suggested portfolio structure. So what I can kind of do is I can pop them side by side, and what you'll be able to see very quickly and easily is we've matched up all of our portfolio requirements that run down on the left-hand side of the screen to the suggested requirements that falls under the Faculty of Physician Associates. So what you're looking at now is essentially kind of our first attempt at making sure that we cover all of the requirement areas for a physician associate. But hopefully the reason I wanted to show you the difference between these two is that you'll be able to see as this grows and as this change, it may be that some trusts have individual local requirements or evidence requirements that they require a physician associate to gather to keep up to date, that actually we can configure our system very simply and easily to do that. So I jumped straight into that. In terms of the system itself, as with all of our systems, it's all cloud-based. It's accessible anywhere with any internet-enabled device, whether it's on a mobile phone, whether it's on a tablet or a desktop PC. And with all of our products, it comes with useful support. The main one being our online chat support, which can be utilised by any physician associate that uses the system as with any other end user. And that will always remain the same for us. It allows us a couple of things. One, it allows us to avoid the requirement to have sort of expensive and time-consuming training, which we don't think we need on our systems anyway, because they're very intuitive and straightforward. It allows real-time support. So anyone using the system for the first time who's unsure what they may need to do, we're there on hand to help. But equally, it allows us to have this sort of constant flow of feedback. So whenever any of our systems are used in a trust, we get to speak directly to, whether it be the doctors, the nurses, allied health professionals, in this case, the physician associates, will be able to come back to us and talk to us about how the system works for them. And if there's anything that would improve that experience, any new requirements, whether it be from stakeholders within the organisation, should the Faculty of Physician Associates change those requirements, that information can flow through to us very quickly. And that's invaluable, and it has been throughout the last 10 years. People that have been with us for a very long time will know that our systems have changed and they continue to change. And we'll always utilise this continuous development cycle, which essentially is you request features from us, we prioritise them, and then we develop the system accordingly, because things change. So I'm actually going to show you here two systems, because one of the things we came up against when we started to look at this was the idea that although this was an evidence portfolio store, so you needed to be able to provide evidence, as we'll go through and see here. Some of these particular sections are very straightforward. It's just really a case of adding information in around things like summary CVs and so on. Other sections, in particular CPD and workplace-based assessments, there is a requirement for you to fill out certain forms or to gather evidence in a certain way. And that's a piece of functionality that we have. It just currently exists in what's known as our Foundry system. So I will show you the other side of this, and that's something that actually we're kind of actively looking that trust to work with us to ensure that we can develop that functionality so the information is integrated and exists all in one place. So in terms of the system itself, as I mentioned, it's all cloud-based. I've got a number of tabs open here, but they are separate systems or separate areas that I'm going to. As with all of our systems, we try to keep things very simple. So as you'll see in here, there's a portfolio. It all exists on one page. On the left-hand side, there's access to user guides. There's the opportunity to download the information as PDF if you need a physical copy, and also the opportunity to go to the appraisal side of things. The structure of the system itself is very clear, and it remains the same regardless of what you're doing. We try to make sure that the structure is always the same, so it's very familiar. Each time I click on a new area, what you'll notice is the title will change and the guidance information will change. So if I go to workplace-based assessments, it will start talking about I think it's pronounced mini KEX, or direct observational procedural skills. It doesn't matter where I go to, the guidance changes based on the area that I'm in. And again, this can be configured. It may be there's some local requirements that you have. It may be that you want more in-depth guidance and information as individuals are going through the system to help support them. All of that is absolutely fine. We're happy to support with those changes. So it doesn't really matter which section I'm in. It breaks down into sort of 3 core areas beyond the title and the guidance. And those core areas here are the addition of evidence. So you can upload evidence into the system. You can give it descriptions. You can email evidence to the system itself and attach it. You can attach it as you would with sort of a generic email if you were just sending an attachment to someone, simply by clicking attach document and selecting it from wherever you've stored it on your computer or cloud-based storage. But as I said, you can also email documentation to here. So I can go in and I can actually attach, useful if I attached it in the right place. So if I was to go in here, let's just keep it in it. Oh, there is one already. So I'll attach another one just to show you. So I can go to existing documents, mini KEX form, and create, and then a new piece of evidence appears. So that's one of the 3 main areas on it. We also have the opportunity for comments and reflections to take place around a particular area that you're in. It may be that there's you want to reflect upon the entirety of workplace-based assessments. You can do there. And then finally, private notes. Now, this isn't something that's utilised a great deal, but essentially the purpose of this is it's something that is exactly what it says it is. This isn't open to anyone else to be able to go in and look at. It's purely private notes. Everything else should be related to the PA requirements for their portfolio, and will obviously be, because part of what the faculty of PAs looks at is the review of this evidence and the requirements within it. So the other areas around evidence and comments and reflections can be viewed by obviously someone within that relationship that's reviewing. The other section on here really is just about saying whether or not they feel they've gathered enough evidence. And this is not a compliance thing, it's not a tick box exercise. If I select complete, it will turn green, but this doesn't mean that nobody need review it. It doesn't mean that this is now complete and it's been ticked off. This purely means that the individual undertaking the uploading of evidence and requirements feels that they've got enough information. So as you can see here, as soon as I say turn it complete, it gives me a quick guide to which areas I need to work on. It may be that I just started, I've uploaded some hours in terms of CPD, but I've not got the 50 hours yet, but it's in progress. So again, quick visual guide to be able to tell you where you're currently at. Now, again, those of you that utilize our systems already should know that we have these icons as well as colors for anyone that's colorblind. It gives you both a sort of visual representation of a symbol as well as color code. Now, I won't go through every single section of here because of time, but just to give you an idea. So one of the things I sort of mentioned was the idea that there are some things that you may just want to upload a piece of evidence. It may be that, as I say, you've got a CV, it's something that's already on your computer, a summary CV, and you need to upload it into this. There are also other areas, as I mentioned, around things like CPD, where you have to evidence 50 hours of CPD. That it isn't, you may not wish to do that as a separate sort of exercise where you're filling out I don't know, a Word document or an Excel document or anything like that and uploading it. Now there is a way in which we can help now, and a way that in the future will be far more seamless as we move through. So I would like to take you to the other side of the system in a second. Of course, you can upload any type of evidence. There's no file size limits. It doesn't matter what the sort of file type is either. You can add all of those as it was. So if you did wish to do and keep a note of all your CPD hours in an Excel spreadsheet and upload it, of course you could. But what we're hoping to do is find even better solutions to make sure that when a physician associate utilises the system, that it's very intuitive, very simple to use, and they're not having to move around too much. So with that in mind, if I was to look at the workplace-based assessments, now there are a number of requirements that exist within here. And one of the things that we've done at the moment is we've added a link in here. So it says click here to log into Foundry, where you can create a mini KEX and send it to your assessor. I won't click in there because I've already got it open here. But for those of you that don't know, we have essentially a form builder piece of software called SARD Foundry. And it is something that we utilise at the moment mainly for nurse revalidation. It's also utilised for supervision. TZESC and Weir do a huge number of supervisions on here. But it essentially allows us to recreate forms that you may have against sort of national standards and put them online. The only section that's currently not there at the moment is the full integration of pulling that information directly back into SARD. And that's something, as I say, we'd like to work with partners to make sure we get it right, make sure it's supported properly to do so. But what I can show you is an example of how it would potentially work. So with SARD, obviously at the moment, it does mean logging into two systems. But if you were to use just our portfolio, you'd essentially be gathering your data from an external source anyway. And some of the people we've spoken to say they use things like Google Forms, which is fine. But this will create an opportunity for you to literally recreate all of those forms within SARD Foundry and be able to then upload them into the system. And in the future, for you just to be able to access the forms via the SARD site, and then they would automatically and seamlessly appear where you needed them to. So as an example here, we've got a mini clinical evaluation exercise for the same person. So it's Helen Matthews on here as well. And if I click on this, essentially what we've done in here is we've recreated the form. So it's got the details, the PA MVR number, the date of assessment, and then the assessment itself. And as you can see, this should be, for anyone who is familiar with the form, this should be recognisable. Likewise on this, we utilise the Foundry system to sort of top up CPD hours. So again, you can utilise the system, you can put something in, add a value against it, and it will start to measure obviously how many of those hours you've done. It's not, by our standards at the moment, perfect because it doesn't integrate at the moment, but it certainly does provide an option for you to start to recreate these forms online the way you need to, because it may be that some of the evidence requirements within the portfolio need to come from an external source. It maybe they can't be recreated. But again, that's the beauty of SARD. We can mix and match various things to ensure that it's relatively seamless in terms of how information will flow to and from the system. So that hopefully gives you a brief idea of two things. One, that we can recreate a portfolio against the suggested profile requirements from the Faculty of Physician Associates. It's very simple to use, that you can upload evidence as you go along, but also that we started to think very clearly about how we can ensure that for some of these evidence requirements that do require you to fill out certain forms or complete assessments, that we can also start to capture those and pull them into the system itself. I just want to sort of finish off on a couple of areas on here. So as it stands at the moment, this is all still linked through to a mag form appraisal. If the mag form appraisal is not of any real use to physician associates moving forward, then again in Foundry we have the ability to recreate any appraisal forms that would. But if this appraisal is fine, then again we can just pull the information through as we always do, which would be sort of underlying mapping to make sure that certain evidence requirements are pulled through, if not all of them, into here. So it's very quick and easy. Again, we have the same hierarchical structures within the system. So in medical revalidation appraisal, for example, your appraiser at a certain point will have access to the full portfolio. Again, we can facilitate those areas, and that would equally sort of play out in terms of sign-off processes as well. So there are some things that I think, as this progresses, we can ensure that it aligns absolutely fully. But I know there's certainly a couple of trusts at the moment that are using this as a way in which to get their physician associates through sort of an evidence annual evidence cycle, and moving on to the appraisal side of things itself. Just the very last thing I want to talk about as well is, obviously within this we have an e-document section. Now this is quite important because there's going to be a reasonable churn over a number of years of sort of evidence that's uploaded to the system. And essentially what this does is it stores all of that evidence, regardless of whether it's sort of in active play in the current sort of appraisal round. It may be from the year before, the year before that, but it does allow you to have this sort of much broader overview of all of the evidence that you've uploaded as time goes by. So I think what I would like to do is really move on to sort of any questions that people may have, because I'm quite happy to go into more detail in terms of each of those sections, but I just really wanted to give you this sort of broad overview for now, and then invite anyone that may have questions to ask them now, if that's okay. All very quiet, so I'll allow people a minute or two to. Anyone got any questions? Just feel free to, if you don't want to type them down, just literally shout. Oh, I've got a hand up, I can see. Who's that?
Hello, hi.
Hi, yeah, can you just introduce yourself and then...
Hi, my name is Rauda. I am a physician associate in Norfolk Park Hematology Daycare. I just wanted to ask regarding when we designate our appraiser on the system, is it limited to that list, or does it need to be our clinical supervisor?
When you say limited to the list, which particular list do you mean?
Because when I go into my SARD, there will be, you need to select your appraiser when it is just a list that contains a limited list of names of the consultants who do this, and I was a little bit unsure whether we can type manually the name of our supervisor, or does it need to be one of that list, which is one of the other consultants?
Yeah, well, I mean, first and foremost, the list can be amended. It doesn't. It's not. It's basically defined by the organisation and the role types within it. So we can open that list up, and within that, you can obviously select or type in who it is and select from that list. I'm not sure if you can type directly in, sort of without it being attached to the list. That's something I would need to find out about. I don't know if any SARD colleagues know, but certainly if someone doesn't exist on a list, it doesn't mean that we can't ensure that that list is available where it's required. So it may be that it needs to be tweaked and changed.
Okay, lovely. Thank you very much.
No problem. Any other questions? We've got, I can see hands up. So I've got, I'll go from the top of the list. I can see Deborah Brooke from Oxley's. Oh, you're on mute, Deborah.
I'm a appraisal lead from Oxley's. Hi. I find that one of the difficulties with SARD is that the supporting information becomes a document dump, and it is difficult to see which of those documents were uploaded in the last year or whatever. And I wondered whether there was, first of all, any sort of idea that the SARD might default to storing that information just in a little section that has the years at the top of it, so at least one would know where to look if the appraisee has not put a time scale on their document. So I was wondering whether the things you showed us about the Physician Associates evidence log is going to kind of manage that in a slightly more accessible way, because at the moment some people have very long lists of documents on SARD which are not sorted at all.
Yeah, I mean, it's one of the things, just to explain, one of the things that we wanted to ensure when we set up sort of the revalidation and appraisal process is that we understood that it wasn't the case that every piece of evidence would be attached to a single year on its own. Maybe only outliers that weren't, but to have the option to ensure that evidence could cut across maybe 1, 2, 3 appraisals. Some areas of evidence, for example, like the multi-source feedback, would go across an entire revalidation cycle. I mean, I know that changed. It was, I think it was 3 years, and then it went to 5 years. What we have done in terms of some of those areas, because it's very difficult to sort of constrict individuals, and unless you actually constrict them to say one piece of evidence can only be put in for 1 year, and then every year you need to re-upload it. And equally around sort of like the naming conventions of things. I mean, obviously, if you're putting a title, it would be great if you put the title and the date that it was uploaded. But what we do have, and I don't know if it's something that you're familiar with, Deborah, is in the e-documents section, is actually we do have the information based on when it was uploaded, but we can also, if we want to, within the attached to, look at the specific year that something was the year that the evidence was attached to. Now I've gone actually to our medical revalidation demo site. But if I was to select portfolio March 2021, what it will do is it will rejig and filter out the data and then say, actually, these were the documents that were attached to that particular year. I don't know if that helps at all, but it's a real balance for us between getting the system to define everything to the nth degree that it means there's no wriggle room and therefore the flexibility doesn't exist, or allowing it so flexible that it can be confusing if there's a huge amount of documentation. But we've certainly tried to address it in this particular way by saying, I can be confident that this was attached to this particular year, and it may be a different year that I'm looking for, and I can go down and say I want to see the portfolio for January 2019, and then take a minute on my computer, but then it will pull the information in that exists within that. It's all a bit messed up in here because in the demo site we tend to add things to numerous years as we've gone through. Does that help, Deborah?
Yes, thank you very much.
Yeah, and that will be the same for the Physician Associate side of things.
Yeah,
well.
yeah.
Cool, excellent. Helen Wilkinson.
Hi, just a quick question about, as you would expect from me, about cost.
Right. Yeah, well, cost-wise, there's a number of ways in which we kind of look at this, because it depends on what level of functionality you wish to utilize. Now, and it's also based on a number of key things. So we tend to try and keep it in line with what the trust cost is in terms of revalidation, which is based on number of users, number of years, number of modules. So it isn't expressly the same for each, but generally in terms of this, you're looking at around sort of the £29 per head mark. But the reason that's a difficult question to answer is because if someone has 10,000 licenses, those licenses tend to be cheaper than someone that has 10. But hopefully that gives you a rough idea. So you'll be able to tell from some sort of what you're currently paying based on those criteria as to what it would be an extension of this. However, if you require sort of less of the functionality, then that's something we can discuss. We do need to think about what the addition of the Foundry stuff means in terms of cost, but it certainly won't be much more with regards to that. But we're more than happy to sort of take each individual request and sort of provide you with what that costing would look like.
That's really helpful, thank you.
Yeah, no problem. Who else have we sort of got? Is it Marilyn?
Yeah, hi, I'm Associate Director of Medical Education and Physician Associate Lead for MFT, Manchester University Foundation Trust. So we've got 12 hospitals and we've got 48 PAs employed, which we have employed them for 4 years. We keep having a battle that they have to use the agenda for change. So there's 2 systems: is the doctor's medical appraisal, which is SARD, and we use the trust agenda for change, but we've now been able to let them use the MAGs, and we were delighted with the faculty toolkit, but of course it's paper based, so it's down to the PAs to download it. We do use a form system, an electronic form system that we use, which is Form Squared. It was used by the students. It's the local university system, but it's not easy to use. You know, it's not that, and so this to me is fantastic, and just hoping that we can persuade our trust that this is the way to go, because we always use it for the medical student. One thing we do with our e-forms though, so as well as sort of your work-based assessments, your DOPS, your mini CXs, we actually include things like reviews, so which meet the faculty. So in the preceptorship year or your internship year, we do things like, you know, 3rd year review, mid-year review, 6-month review, that sort of thing. Now we can view those and do an audit on it. Is it possible to be able to do audits so they would be like the PA team could view and audit the data to see, you know, who's got the job plan uploaded, for instance, who's been completing the DOPS? Is that possible?
It's certainly possible around the areas that we've currently got in, so things like job planning and various things like that. If you were to utilize something like Foundry for your reviews, if you had like periodic reviews, then yes, because that's not too dissimilar from sort of just the clinical supervision stuff that we do in there. So you've got forms that you can look at. We essentially our system is very auditable. It stores kind of everything that's taken place on it. I don't know, Kevin, if you wish to speak more to that in terms of the sort of technical side without being too techie, but essentially,
I can try not to be too techie, but yeah, I mean, I think you've nailed it there. We store everything that happens. Reporting generally is one of our sort of strengths, so it's something that when it comes to reporting, I think there's so many different ways to report on everything, you know, job planning, appraisal, revalidation, MSF, you know, you name it, whatever product it is. There's so many different ways to cut things. We often wait for, you know, the administrative team or the governance teams to say this is what we need, and then we use that as and we go away and build it essentially, rather than try and sort of preempt what you need. So I think we're very adaptable to the reporting requirements that you have, but certainly all the information is in there to run the reports.
Okay, thank you.
Does that answer your question?
Yeah, it does. Yeah, really helpful. Thank you.
Yeah, I mean, as you can see from this, this has grown exponentially from when we started. I mean, our latest one is ASPAT for medical revalidation, but as Kevin said,
nearly all of that is user led. You know, the reports that come out of there are things that we've been asked for, rather than us sort of inventing the functionality and then saying, here you go. I think pretty much everything in there has come from the clients.
Yeah, and that actually is really important with this particular area, because, you know, we're not we're not trying to pretend we've had a physician associate system for a long time. We've been keeping under wraps. This is, as I said, this is relatively new to us, but because of the adaptability of the system, we were able to transition quite quickly. But that, as Kevin said, we want it to be user-led, because ultimately this has got to be useful for the trust, not just what we think would be useful for the trust. We'd rather you say to us, well, we need this and that and the other, then we can build it.
Okay,
So,
thank you.
lovely. And then Louise Dexter.
Hi, how are you?
Hi, Louise. Yeah, good. How are you?
Good. I'm going to ask you how it'll work from the admin side, Phil.
Right. You are that again, as with sort of Kevin's answer, we will be led by the organisation in some respects, certainly around reporting. In terms of the admin side, it really is a case where, as you probably know from using the system before, that we can actually set up particular roles and groups of people. So we would just be able to set up a group of physician associates. I don't know if it exists already in this one. Let me have a quick look. I imagine it does, but in our dataset matrix, for example, and this, for those of you that don't know, is the core evidence requirement area within all of our systems. So this is actually quite a neat little one. I know it's difficult to read, but you can see there's different groups: dentists, educational supervisors, medical practitioners, physician associates. What we then do is create the different types of evidence requirements, and then simply as a group, you can just assign them to the particular. So you can see here under medical practitioner it stops, but under section 12 these are all physician associates. So it would separate out the users in the same way that you would. So King's, for example, have a lot of dentists, always have done with us, and they've always used the system. So that's one way. In terms of administration around user data, the same as always. You know, there is nothing would change for those people that use our system. In terms of adding new users, you can do that sort of at will. You don't need us to do it. We're happy to support. In terms of the reporting side, as Kevin mentioned, we want to build up anything that's particular to this group that doesn't already exist within the system. Things like compliance and so on, have they, you know, if they completed all the elements, those are very straightforward. But there may be, as Marilyn talked about, some areas that are sort of more auditable that you need reports on. But yeah, and then in terms of the other reports that you do or don't want them to be part of, so it may be things like AOA reports that you do or don't want them to be part of, because they're assigned to groups. Obviously there's ways in which we can ensure, because dentists don't exist in those, so we can just ensure that they're not but
included in the data. Yeah, that would be great. The only issue I can see is that we have a list of trained appraisers for medical appraisal, and we need a separate list for physician's associate appraisal.
Yeah, well, I mean, again, these are all relatively straightforward things for us to.
Good.
So, yeah,
that's great. Thank you.
No worries. Is there any other questions for anyone? Because that's all the hands up I had. I don't know if is there any comments or anyone else that wishes to ask a question. We've still got a few minutes left. I will sit with this awkward silence for a minute. No, okay. Well, one of the things we tend to do after this is we will obviously pop you. I think Chris and Jan or will send you a just sort of follow up. If you do have any questions, if you want to see any more, if you want to go into any more detail, if you have any queries about any of the other things that we do that we haven't covered in this webinar, product-wise and stuff, then feel free to ask. I hope those of you who know us know that we're incredibly accessible, and you know, and that goes from sort of Kevin and myself, everyone really happy to chat through things with you. And yeah, I think that's largely about it. I don't know, Fran, if you're there to be able to give us the date of the next webinar. I think it's in about a month's time.
They are always on the first Thursday of the month. So off the top of my head, I'm not, but I'm just checking my calendar. So yeah, the next one will be on the 7th of October, and that's going to be on e-rostering.
Lovely. So anyone here that's got any interest in that, just feel free to contact us, or if you've got any colleagues that you feel would benefit from coming along to the e-rostering webinar, again, just get them to contact us directly. But beyond that, I'd like to thank you all for your time. I hope you found it an enjoyable and informative experience. We look forward to speaking to you all again at some point. So thank you very much.
Thanks, Phil.
Thanks, Bill. No worries. Have a
Thanks,
lovely
mate.
day.
Really good. Thanks all for coming.
Cheers. Thanks, Linda.
Bye. Bye.
Bye. Right. Well, the numbers all.
Yeah, very good. Well done. Very good.
Well done, Phil.
Thank you.
Well done.
Oh, dogs come on.
Fig left it right to the end.
Yeah, that's good. Is the recording finished?
Yeah.
Yeah. Let me stop it. How do I stop it? Stop the recording.
More actions. Stop recording.